My uncle, my mom's brother, in his early 50s, passed away from a sudden cardiac death event. And that got me very intrigued and really drove me towards the field and specialty of electrophysiology. So as cardiac electrophysiologists, we're the rhythm specialists. In simple terms, we're the electricians of the heart. So the unique thing about electrophysiology and the rhythm disturbances, it can happen at any age. So in my prior practice, I used to see pediatric patients as well. But truly, it's any age group, all the way from 18 to 99. We deal with patients that have slow heart rhythms, the type of patients that might end up needing a pacemaker. Patients that have fast, dangerous heart rhythms that cause sudden cardiac death or cardiac arrest. In the middle of it all is a spectrum of patients that have rhythm disturbances like atrial fibrillation, SVT. These are other rhythms that may require ablation procedures, which are minimally invasive procedures where we go find and try to manage these rhythms. If we have no idea what we're dealing with, then it is a lot of investigating and trying to figure out heart monitors, trying to catch these culprit rhythms. If we already know what we're dealing with, then it is about whether it is medical therapy for certain conditions versus whether it is offering them a procedure that can be curative for some of these conditions. All of the specialists, all cardiologists and subspecialized cardiologists sort of work together in a unified manner. So it is all the way from prevention to diagnosis to managing these conditions in a team-based approach, and that's very unique. I think the thing that excites me the most is it's ever evolving. We have access to tools and technology that help us make a lot of these procedures and the diagnosis much more efficient, much more safer, and everything ends up being in the best interest of the patient. When there are patients that have rhythm disturbances that are very interfering a lot in their day-to-day life, and when we cure them with one single procedure and they feel like a whole new person, that is truly the most rewarding feeling, to be able to give a person their life back. I'm passionate about what I do, and work doesn't feel like work when you're passionate about it.